Microneedling, skin pen. How effective is this procedure in improving the skin texture? I had silicone injected years ago in areas of my face. Will the needles disturb the silicone that was injected, or do the needles not penetrate that deeply?
Thank you for your question. You submitted your question without a photo, and you're asking your question, how effective is microneedling in improving skin texture? Further, you described that you want to know about the depth that the needles would go because you're concerned about having undergone silicone injection years prior, and certainly that's an area of concern. Well, I can certainly share with you how I counsel my patients when it comes to skin texture improvement. It certainly is a big part of a practice like mine focused on a lot of facial aging. A little bit of background, I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Microneedling, as well as the use of lasers and radiofrequency technology, as well as the use of PRP and injectables, is part of the routine in my practice every day. So I can give you some sense of how I would speak to a patient who has similar concerns. It is certainly an important part of your evaluation to always explain that you did have these silicone injections. In our area, practicing in New York City, we've had a handful of doctors who were big proponents of silicone injections, and certainly there's a lot of people who have had these procedures done. What we've, of course, seen over time is, although the silicone itself is, quote, permanent, the skin is not, and that the skin becomes thinner as you age, and there are some people who can have some irregularities and you can actually see the silicone, and others you don't really see it, but you're aware that they do have it. Now, it is important for you to recognize where, or at least if you can, be able to tell your practitioner where on the skin the silicone is. A lot of times patients have come to us who got silicone injections done for the vertical lines around the lips, to plump their lips, to place it on the border of the lips or the body of the lip, as well as for some fine lines. And they always describe the doctor as putting very minute amounts, and that's kind of the standard as it has been practiced. The trouble is that silicone can potentially cause inflammation. And inflammation from silicone can occur as an immune response years after it's placed. It is a area of concern in my mind that if you were to do microneedling and the needles were to penetrate the capsule that's around the silicone, is there potential for leakage? Is there potential for inflammation? So if you cannot, with clear certainty, state where the silicone is, I would probably hold off on doing microneedling. If you are going to do it, maybe you can try doing it with limited areas, but I would be concerned about that. When it comes to a conversation about skin texture, I would say that a lot of times what patients describe as texture is a combination of volume loss in the dermis, which is the backbone of the skin that provides its structure, as well as volume loss in the deeper levels, which includes the bone, muscle, and fat. Then last, and the most superficial level, is the epidermis. Now the epidermis is often overlooked in the aesthetic field because we're so focused on restoring a lot of other more obvious areas. So I tend to take an inside-out approach. So when you look at your skin and you think that the skin looks rough, well, it could be also that there is an opportunity to maybe use an injectable filler at the deep level. such as what we do in our practice, a procedure called structural volumizing. When we do structural volumizing, we're placing a long-lasting filler like Juvederm Ultra Plus, Juvederm Voluma at the bone level. Now, the argument for doing that to treat texture is that when you restore this volume, which has been lost by bone loss, you can actually give the skin some stretch, and not overstretched, but to restore some volume. And when you restore volume, you actually get more of an even looking texture. And this is often mimicked sometimes when patients do a mirror lift, when they pull their skin up and back. But if you restore volume, we've seen this when we've done this for patients who have acne scars. You put volume at the deeper level, the skin fills out, and the scars look less deep. At the dermal level, you may consider some use of a filler such as a softer filler or a less viscous filler, but again, be aware of where the silicone is, and it may or may not be optimal. When it comes to the more superficial or the epidermis, there's a layer called the stratum corneum, which is the top layer of dead skin cells. There are a lot of different modalities to help keep that area refreshed, and it is very important for skin function to have a turnover. And this is something that people know about, but often is not optimized. It's kind of like exercise. Everyone knows to exercise, but not everyone does it in the best way that suits them and benefits them. So in our practice, we do something called HydraFacial, and it's become my go-to for treating the epidermis. Why? Because HydraFacial is essentially a technology that uses the concept and principles of microdermabrasion, but uses water. And it takes off that top layer of dead skin, and at the same time you can infuse active ingredients such as glycolic acid, and you can get certainly a textural improvement. If you do that with consistency, I think you'll find a potential value in using this type of modality. So think deep and think superficial, and if, depending on the extent of silicone you have in the backbone of your skin, in the dermis, you may or may not be someone who would benefit from other injectable fillers in those areas. So meet with qualified, experienced cosmetic doctors who can potentially help you in this way, and learn about your options and see if you can get a sense of exactly where the silicone is placed, so your doctor can be strategic and optimize their approach. So I hope that was helpful. I wish you the best of luck. Thank you for your question.